Let's Achieve Change is a podcast by Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. I propose to be that advocacy channel, making you aware, bringing the public more information on health and wellness topics, especially as it pertains to chronic pain and disabilities. I would like to be that voice for those silent sufferers out there who are not able to speak for themselves. If you'd like to know more about Let's Achieve Change, please visit our website at changeachieve.com or pamelagrove.com. If you'd like to be a speaker or you know someone else who wants to be a speaker, also visit the website and leave your email information and we will be in touch with you as soon as possible. Let's Achieve Change will air every 2 to 3 weeks, bringing you various topics on health and wellness and making the public more aware of issues that are not being discussed. We thank you very much for tuning in. Hello. Thank you for joining me today on Let's Achieve Change. I'm Pamela Grove, Doctor of Physical Therapy, Pain and Movement Specialist of Metanoia Education and Wellness Center. Listen, if you want to make some changes, you have tuned into the right podcast. Now listen, don't forget to hit that notification button so that you can subscribe and you won't miss any future episodes on some changes you might want to make. Hello all, welcome back. We're in episode 2 of season 3. And today I want to discuss a little bit about an issue that is very prevalent and seems to be affecting many. And this issue is basically a lack of communication, okay? So we're not even talking about dismissiveness. That's another can of worms we're going to open up much later. But I'm just going to discuss that Johns Hopkins is probably one of the leading researchers in healthcare. And they did a study to see whether patients would get better outcomes if there was ongoing better communication among providers. And the results was, of course, yes. Okay. So what do we mean by good patient outcomes? Well, simply, do patients do better with their procedures after their procedures, or do they do better with their chronic diagnosis following up if there are healthcare providers or simply taking a few extra minutes to communicate properly and following up? And the answers are yes, simply yes, right? And to me, this is more of a humane issue. It's not something that is a bit legislation has to be done, okay? And we can just dive into the fact that, are we following up, right? So today we have a guest. Her name is Kim. She'll be coming on and she's going to share a little bit about her position and some of her experiences in these areas. And she's going to share some resources. So for not longer prolonging, even for further ado, we're going to bring on Kim. Thank you. Hello there. So today I'm excited to have Kim on board, and Kim is coming to us from a perspective of as an advocate, as well from a professional standpoint. I'm quite sure she may have some personal experience as well. So Kim, welcome.
Well, thank you. Thank you very much.
How are you?
I'm good.
You're good? Good to hear that.
Yes.
You're good to hear that. So in your own words, I can tell you my perspective on it, but in your own words, what does it mean to be a patient advocate as far as you're concerned and how do you play a role in that respect?
Well, how I play a role in that, I am a psychiatric mental health clinical nurse specialist.
Okay.
So I do have to advocate for my patients. Some of them are not able to advocate for themselves. And so that involves a lot of education, coaching them on how to handle these problems in the healthcare system. Like say, for example, they can't afford their medication. They can be educated on, there's like manufacturer coupons that you can get.
Yeah.
They can bring your medication down to $0 sometimes, very low price. How to navigate some of them have never even called their insurance company.
Right.
And so to advocate, this is something you need to call the insurance company and talk about XYZ. So I find that it's a lot of education, or sometimes they need some type of referral to, let's say they need to go to outpatient treatment and they have absolutely no idea who to call or what to do.
Yeah.
And so I have looked things up for people and say, here's a list of places. Please give these people a call. They should be able to help you, that type of thing.
Okay.
Also encourage, I seem to have seen this a lot with the elderly.
Okay.
That they often don't have a clue as to what to do. And with them, I'm really trying to educate them with the processes. I mean, they'll come in and they're upset today and anxious because they can't get their primary care doctor to call them back.
Yeah.
So I try to help calm them down to give them ideas of what to do.
Right.
Situation.
Right.
Because just little things like that can just set people off and cause depression and anxiety.
Exactly.
And so they need people to help them understand what they need to do to help themselves.
Yes. So, and so not to cut you off, but I just want to keep getting to zero in on things. So can you give us some specific examples, probably some of the ones that was probably the most significant ones that was like, either a person was in dire need of something, or whether it wasn't easy in the beginning to get to the point where you thought you were going to make a difference and you saw it turn around because of some things you did?
Yes. I mean, I can think of some things that I've done, like help people find services to help them. Let's say maybe they need inpatient treatment for mental health issues, or I've helped people find, like I say, outpatient treatment for people who had eating disorders. So I'm helping them find these types of things.
So not to cut you off again, but is it just maybe of your years experience, you have like a list of resources that you go from?
Not necessarily. Sometimes I'm just as clueless as the patient, but I do know how to find the information.
Okay.
So I might be accessing Google.
Okay.
Putting in what it is that I'm looking for, where I'm looking for it.
Okay.
And so I do rely a lot on the internet. To help out, and then some people, they don't know how to do that.
Yeah, that's true. That is true. Yeah.
Okay.
So pretty much it sounds to me, as you're speaking to them, you can kind of see what kind of situations they may have. You do zoom in on the problem solving. You might do a little bit of Googling, whatever. You then start to map it out for them, what they need to do. I'm saying it like this because I want someone else out there to listen and say, you know what, systematically, this is what I might be able to do as well.
Exactly. Yes.
So yeah.
And as far as being a healthcare provider is, you have to listen.
Yes.
You have to sit and listen and hear them to find out what their needs are.
Yes.
It's just as simple as that.
So,
and I do get a lot of upset people because they feel like some of their healthcare providers don't listen to them.
Yeah.
It's just, you come in, you see them, they're like maybe going to throw medication at you and go. Well, that's not going to take care of the whole picture.
Right. So, and I know you've been around for a while, so it's not. So bad. Have you seen a decline in the lack of care or people listening? Have you seen a trend in the last 10 or 15 years, or do you think it's pretty much been like that most of your career?
I do think I see a decline in healthcare, I'd say, over the last at least 10, maybe 15 years.
Can you speak on what you're referring to?
Yes, I seem to talk to more people who have problems with trying to get in touch with their healthcare provider, but they're not responding to them. And even though we now have access to patient portals, I mean, it's just more than making a phone call to your healthcare provider. Oftentimes you can send them a message on the portal, or there's various ways to get in contact, but yet still nobody will call them back.
Yeah.
I have heard this countless times.
I have too.
And it's just frustrating.
Yes.
You should be calling your patients.
Yes.
Even if you know what the answer to what their question is, you can at least say, let me look into that.
Exactly.
And I will call you back.
Yes.
And so I don't understand why all of a sudden this seems to be a bigger issue than it used to be.
Yeah, I'm trying to figure it
this,
out too. Yeah, yeah,
I've been doing this 20 years,
yeah.
and why is it getting worse?
Yeah, I agree. That's why I want to get other people's perspective, because I feel as if I see that as getting worse too. And I'm thinking, is it because it's just that many more people accessing healthcare than before? Or is it just,
It's possible. Maybe
yeah?
is the system overwhelmed? Are there not enough providers?
Mm-hmm.
I'm not sure.
Is it because when we're training people, we don't give them the latitude to become more understanding and more compassionate and more allowing more time for them to do some more problem solving with patients, maybe?
That's what I've wondered that too. In fact, I feel like perhaps healthcare providers, when they are being educated, becoming doctors and nurse practitioners and all, need to be educated on this is very important.
Yeah.
To listen to your patients,
Yeah.
call your patients.
Yes.
It's not hard.
Yes.
It's really something that's very easy to do.
Yes. Yes. Yes.
Mm-hmm.
Okay, so we're both on the same page with this. So
yes,
I'm not just going crazy over here thinking.
No, you're not. No.
So I want you to dive in now, and I want you to think about maybe if you had all the money and all the resources that you had, and they say, okay, Kim, you get to make the decisions. What would be some of the suggestions? Can you think of something that you would practical, maybe you would think of that maybe we can start to think what could make a difference?
Well, number one, I feel like everybody should have access to good quality health care.
Yeah, I agree. Yeah.
So some people get access to health care, but it's not what I consider good quality health care.
Yeah.
Which, in my opinion, these providers need to be educated that this is how this should be done. I have seen healthcare professionals myself that I have worked with that were giving care, but not good quality care. And listening to their patients and helping them with the things that the patient feels like they need help with.
Now let's back up a little bit, because we got to get to the nitty gritty here.
Okay.
So, and I can also test the fact that I've seen I'm a doctor of physical therapy, and I've seen in my profession therapists who have not done quality care. So I can also attest to that. So coming from your perspective as a specialist in nursing, have you ever questioned or even asked, like, why don't you guys do this thing? Have you ever questioned, or have you ever heard any comments of why they don't do some of the things they should do?
I can't think of a particular situation where that has occurred, although in my mind, I'm like, why aren't you doing that? So I don't have.
Oh, you haven't had in all the 20 years. You have never had the conversation with any other one of yours.
I've had a few interactions where I had to. Well, what is your rationale for doing X, Y, Z?
Yeah.
And oftentimes it doesn't make sense. Now, haven't had a lot of these occasions, but I have had some.
So what's been some of the rationales?
Oh, it just, the patient, they just don't listen to me. They don't, it's like they put it back on the patient. Okay.
Yeah.
When I felt like they were the ones who weren't listening to the patient.
Yeah.
Versus the vice versa.
Yeah.
Or they're not following my treatment plan. Well, they're having trouble with your treatment plan. Perhaps your treatment plan needs to be revised.
Exactly.
That type of thing.
Exactly.
This is not working. That type of thing.
Do you find that there's a difference with maybe certain, I know you mentioned elderly patients, but do you feel there's a difference with, so we say elderly age groups, nationalities or economic disparities? You've seen any difference in the way the care is provided for any particular groups of people, or has it been across the board you've seen?
What I've seen is the elderly, especially, and then comes women.
Okay.
Of all nationalities.
Okay.
They're often, I've seen them dismissed because maybe they think they have a medical issue and they've been sent to a bunch of different specialists because it's like people are like trying to just they don't want to deal with it, so they'll send them to another specialist,
Mhm.
and then
Mhm.
they'll send them to psychiatry because they think they're just have mental health issues.
Mm.
When in fact they don't.
Mhm.
I would say some of them might, but not
Yes.
everybody
Yeah.
doesn't
Yeah.
have a mental health issue. It's just one way of just passing the buck.
Yeah, I think that's called gaslighting. I kind of dealt with
It
that
is.
issue some episodes back, but that's also too a big thing. It's the gaslighting, like you mentioned that. Yeah.
Yes, yes. And that's where I see it the most in
Okay.
those two situations with elderly and women.
Okay. Okay. Mm. Okay. So we still agree on that one as well too.
Yeah.
So do you feel as if any of your actions have made a difference? Do you feel good about some of the things you have done?
I do. I mean, I've had some patients, like I had one recently. It was a brand new one. She's a brand new patient, and she came in. She's had a history of getting help for her mental illness. Pretty stable on her medications. And I sat and listened to what she had to say, listened to her story.
Okay.
And she thanked me several times for taking the time to sit and listen to her.
Yeah. Oh, yeah.
And then she actually wrote a letter to our office stating that she was very pleased with the services that she received that day. So, and I've had things like that happen over the years.
Yeah.
Where people tell me, they'll say things like, when you said X, Y, Z, now this could have been like 3 or 4 years before. When you said that just really made a huge difference. And it's not like it just happens. I respond.
Yeah.
Sometimes it makes a huge difference in their life.
And my point to that. This is my point to that. How simple was that? How much time extra did it take you? Maybe an extra 5 minutes, maybe 6.
Maybe.
Yeah. You know what I'm saying? Yeah.
Yeah. And it does make a big difference. One time I had a woman stop me in the grocery store and say, I hadn't seen this woman in years when she stopped me in the grocery store and said, do you know when you said XYZ to me all those years ago, it changed my life. Yeah. Yeah. And she says, I want to thank you for that. So it's just those little things. If you listen and take the time, you can make a big difference in somebody's life.
Yeah. Yeah. And I'm hoping that we're going to start to get more and more people listen and think about these things and just reevaluate themselves. I mean, I know there have been times where I've had personal problems up to the yang and not been as engaged as that maybe I should have been, because we all are human, you know what I'm saying?
We are, like I really emphasize the listening. And I had a personal experience in December where I had been very sick with a respiratory infection.
Okay.
It was the weekend and I needed to see a healthcare provider. So I went to immediate care, urgent care.
Okay.
And saw this nurse practitioner. And as I'm talking to her, she said to me twice, she says, okay, you can go now. And I'm like, now the first time she said it, I was stunned. And I'm just looking at her and she says, yeah, you can go now. And I'm like, she just told me that I need to go. So I left. And never finished the conversation. But that's an example of what's going on at them.
I know. Oh my God.
I'm like, I can't believe she just did that.
I'm sorry, but I can see you sitting there and you're stunned about this.
Yeah.
You know what? I'm just thinking just that quickly when that came across my mind just now when you said that though, I'm thinking, I think too, with us texting all the time on technology texting, I think we've lost the ability. I'm not saying myself personally because I'm going to have a conversation with you quickly, but I think for the most part, I think people have lost the ability to have a conversation too.
I think that you're right.
Yeah.
I think you're right about
that's
that.
coming across clearly in my mind right now. I'm thinking, how many people they ask to talk to you? They don't talk. They just text.
No.
So, yeah.
Yes.
Okay, so
Good example.
go ahead.
I said that's one of my good examples.
Yeah, because I was just thinking about that. But okay, so let's try to sum up because I do want to give people like a little list of some things that they could do, maybe resources. So I know you say you Google a lot, but if just in your experience, your years of experience, because I know I heard you mention something about the fact that they can get their medication costs down,
right?
And maybe get into like inpatient or outpatient admissions if they needed that. So can you give us maybe a little bit of a listing of like what some of the steps or some even more specific, maybe some medications that you have seen a lot of problems with that you've gotten down, just something more tangible.
Sure.
More tangible.
I can say that with branded medication, that means there's no generic for it.
Mm-hmm.
Any branded medication, go to the manufacturer's website. Mm-hmm. Now, there's a lot of other people that are out there pretending to be the manufacturer website. Mm-hmm. So you need to make sure you go to the manufacturer website, and there are coupons online to where you can get medication for free.
Okay. So let's back up. Let's back up. You got to remember, we're doing like ABCs here. So let's go back. Right. Okay. So let's give an example. So even when you say branded medication and generic, some people are like, I have no clue what you're talking about.
Okay. A branded medication means there's no generic for the medication.
Give us a name, a specific one.
Oh, okay. So let's say Zoloft is an antidepressant medication. Okay. It is the brand.
Okay.
So the brand of Zoloft.
Okay.
Now you have a generic medication for Zoloft.
Okay.
It's called sertraline.
Okay.
Okay. So sertraline is the generic. Zoloft is the brand.
Okay.
They're both Zoloft. Mm-hmm. But the generic can be anywhere from 80% of the branded medication by law up to 120%. So what they do is sometimes add some fillers to it. Okay. So sometimes you'll get the manufacturers actually producing the generic medicine.
Okay.
That happens. So when there's no generic available for your medication, then that's when you would go to the manufacturer's website.
Okay.
And then you would look. And usually it's like when the webpage pops up, it'll say something like reduce cost of medication or something, or like medication coupon.
Okay. Okay.
Click on that, print it off, and take it to the pharmacy with you.
Okay. Okay. Okay.
And another way to save money on your medication is, let's say you have insurance and your insurance refusing to pay for whatever it is you want. Mm-hmm, mm-hmm. They're like, no, we don't cover that. Mm-hmm. You can go and Google GoodRx. Mm-hmm. Okay. Mm-hmm. And when you do that, you have to install that app on your phone or your device. Okay. And then you can put in the name of your medication, and you'll be putting in your zip code so it can look in your area. And it can tell you the cheapest price for that medication. It'll give you like about 10 different prices. Like if you go to CVS, it's this, Kroger, it's this, Walmart, this.
Okay.
So oftentimes, if you do that, it's cheaper to pay out of pocket than what your copay can even be.
Wow.
Through insurance.
Wow.
I have done that personally myself on a number of occasions. Mm-hmm. And because sometimes your copay is like $100, but you can buy it off,
especially if they have a high deductible, right?
Exactly. Yeah. Yes. Mm-hmm. And so that often does help.
Okay. All right. So that's good information. So we're going to say this because I'm making sure that we get it across to them. So you guys out there if you have a medication that is a brand name, and she gave an example of Zoloft, but with Zoloft has sertraline as a generic. But if the medication has a brand name and you don't see any other name that's coming up or it's not on your prescription or whatever, then you're going to go on your phone or your computer. You're going to put in that name, and so it can bring up some options for you of how to maybe possibly get a coupon, or like she mentioned, you can go to a GoodRx, that's capital R, capital X, and do the same thing to find out in your area where you might. Yeah. Okay.
Yes.
Okay. All right. Sounds good.
Mhm.
Okay. Now, how about if a person is having, what would be some indications that a person might be having some symptoms that they might need to be seeking maybe a possible outpatient admission or inpatient admission from your standpoint?
Well, from a mental health
Mhm.
standpoint, that is usually when a patient is becoming suicidal.
Okay. Okay.
If they reach that point where they're having serious thoughts of harming themselves
Yeah.
or even thoughts of harming somebody else,
Yeah.
then that's when you want to look at inpatient services. If a patient is just really struggling with severe depression, then you might be looking at some outpatient. It's like a partial hospitalization. It's like you go to a facility during the day,
Mm-hmm.
so maybe for about 5 hours, for
Mhm.
example,
Mm-hmm.
and you don't stay there and spend the night, but you're going to different like classes and groups and things like that to help work on these issues. You have
Now, how would somebody who is either could be a family member already who acts as an advocate for their patient or for their family member, or even if a person themselves is listening to this? So what would be their steps to go? Maybe they think they are feeling depressed and they have been suffering with depression, because there's nothing to be ashamed about. But I think that's another thing too, is come to terms that there's nothing to be ashamed about. And then we're experiencing these feelings, or do you see your loved one experiencing this? Then what would be the next step then at that point?
Well, it depends on the situation.
Mhm.
If somebody, let's say they are suicidal, they are having thoughts and a plan of harming themselves,
Mhm.
I think a good place to start out is the ER.
Mm.
Okay.
Mm.
Because what they'll do is bring in a mental health team to do an assessment
Mhm.
to see what your needs are going to be.
Mhm. Mhm.
And then they can transfer you to a mental health facility for inpatient,
Mhm.
or they may discharge you and recommend the outpatient treatment.
Mhm.
I don't know what kind of resources they give them at the hospital.
Right. Right.
Usually that's when they contact like a psychiatric office to make an
Mhm.
appointment to get in.
Mhm.
And then what we do is assess their needs. Is this something we can do in office to help them?
Mhm.
Or do they need to go to partial hospitalization, that type of thing?
Okay.
Oftentimes it's we can handle it in the office.
Okay. Okay.
Okay.
So basically, you're thinking go ER first, and then
Yeah.
let them be sent that way, or we already mentioned that they can try to call their primary care, but we might be talking about days before we get a call
Right.
back.
Right.
Uh-huh.
It could be.
Yeah.
And in fact, I've had that happen before,
Wow. Yeah.
which is,
Yeah.
sad.
It was detrimental, probably, right?
Yes.
Wow, that's sad.
Yeah.
It's really sad. Yeah.
Mhm.
And see, that goes back again to that lack of follow through from phone calls from health providers.
Right.
Yeah, that's very sad. Yeah, I hate to hear
Yeah.
that.
That's why it's very important to call these patients back because you don't know
Yeah,
what it could be.
exactly right. Yeah, exactly right. Yeah.
Right.
Yeah. Wow. Okay. Well, I know you've been so helpful. Is there anything else you think you need to add? You can add that will make a big difference. You think? I think you've done some good things with the.
There's some other, if you want more information about patient advocates, there is the National Patient Advocate Foundation. You
Okay.
can Google that online and it can kind of help you navigate any questions that you might have about advocacy and things that you can do.
Do you have a telephone number? Or is it called National? Because I want to say it again.
It's National Patient Advocate Foundation. I can
Okay.
give you the email address. Well, not email, their website.
Yeah.
It's N as in Nancy, P as in Paul, A, F as in Frank, .org/issues/.
Okay. So we got N as in Nancy, P as in Paul, F as in Frank, .org, O-R-G, // issues, ISSUES, /.
Yeah, except for I think you left out the A, NPAF.org,
Okay.
one / issues, and then it ends with a /.
Another /. And that's
Mhm.
advocacy, national advocacy. Okay.
Mhm.
I think that's great. I think that's a good start too, because people just taking down that information and hearing that over and over again. I think that's a good start too for a lot of people. I'm so happy that you shared that.
Yeah. Also, I would encourage people, if they have questions about their insurance or what's being covered, what's not being covered, having trouble getting medications approved, call your insurance company. They can tell you all about it.
Mm-hmm, mm-hmm.
Okay. Just don't leave it up to the healthcare provider, but do your part.
Right. And that's just looking at your card, your insurance card, and the customer service number on the card.
Yes.
Yeah. The customer service, yeah.
And also those who have like Medicaid, Medicare, they have resources. Call them if you're not sure what to do with that. Give them a call.
Wow. Good. Very good information, Kim.
Good.
Good information. I thank you so much, ma'am.
Okay.
So what can I call this chapter for you? Nurse Kim?
Nurse Kim.
Nurse Kim.
Yes.
I mean, if that lady who came back and said, you know what, when you told me X, Y, and Z, you made a difference in my life. You know what I'm saying? So those people who can come back and say over and over again, yeah, Kim made a difference. Kim said this, and she took a few minutes for that. And the one who wrote that letter and say, Kim did that. So, how will we sum up Kim?
I just would say, be a good listener. If you see there's a problem, try to take action. Because we're here to help these people who have come to us for help.
Okay.
Sometimes it's not smooth, right? I can think of an instance where I had this college student wanting me to write a letter for him, but he wasn't telling me all of the information. And it took, after about 4 or 5 times seeing him asking me to do this letter, finally got his father on the phone. And he explained the whole situation to where, I can write that for you.
Okay.
Because you might not be getting the whole
story.
So, sometimes you have to pull that out of them.
So it's not just being a good listener, though. It's also, too, it's being willing to ask questions.
Yes, absolutely.
Yeah. Asking them questions.
Yes.
If you're sensing that they're trying to tell you something, ask them more questions.
Ask them more questions.
Ask them more questions, yeah. Thank you so much, ma'am.
Okay. All right. You have a great day.
You too. Okay. Bye-bye now.
Okay. Bye.
So thank you so much, Kim, for what you have come to the table with. So in conclusion, basically, the studies are proving, and Kim shares some great information, that one of the biggest things is that active listening and follow-up, right? Okay. Both for patient outcomes. And, in this day and time, there's really simply, I know I get very busy too, and sometimes I forget these, but you can give yourself just a little note, put a little note there. You can put a little reminder on your phone, anything like that, to say, talk to this person, follow with that person, whatever. Like Kim, she told me, she laughed about how that employee just pretty much said, we're done, you can go, and not even finish the conversation with her, right? So I'm just begging all of us to take inventory, because, basically, this is a simple principle. It can be applied not just for providers, but also into any social. It should be a social standard, right? That we just take time, right, to make sure, because the ultimate goal should be what? That we ensure that we're making a positive difference in the lives of others, right? That we're making a positive difference in their lives, right? So basically, just take some time and just say, what, let me make sure I'm listening to this, because it can make a difference. It can be a life or death situation. And then I'm not exaggerating, because it has proven that's been proven. Okay. So I'm so happy that you guys are staying tuned. I'm believing that you'll continue to stay tuned. Next episode, we're going to dive into even more issues that are reflecting and hitting harms and resulting in solid suffering of many. Until next time, I'll talk to you soon. Thank you. Thank you for tuning in today at Let's Achieve Change. Don't forget to like, share, and subscribe. You will find out more about Metanoia Education and Wellness Center on our website at changeachieve.com. We welcome your questions and your feedback. Please feel free to fill out the form on the website and we will contact you directly. I pray that you prosper and be in good health, even as your soul prospers. Remember, it's all about the change. Thank you.